Imagine gaining the knowledge to potentially sidestep one of the leading causes of serious long-term disability. Think about the impact that could have on your life and the lives of those you care about. This isn't science fiction. It's a deep dive into the very real power you have over your health destiny, specifically concerning stroke prevention. Welcome to the Deep Dive. I'm your host, Dr. Hana Lee, a researcher with a PhD in integrative medicine. And joining me today are guides through this really crucial topic, Dr. Thomas Reed, a practicing physician focused on elderly care. Welcome.
Thanks. It's vital information, absolutely. And I'm ready to help unpack it. You know, so much of what we encounter in clinical practice could potentially be mitigated, or at least the risks lowered, with better preventative knowledge. And stroke is definitely high on that list.
Absolutely. And our mission here in this deep dive is really to take source material. And for this conversation, we're pulling primary insights from a Harvard Health article, which aligns beautifully with guidance from major organizations like the American Heart Association, and really extract the most crucial, actionable nuggets of knowledge on stroke prevention, specifically for you, our listener. We want to cut through the noise, give you a clear understanding of what truly matters based on these reliable sources.
That's exactly the goal, because look, when we talk about stroke risk, it's easy to feel overwhelmed or even fatalistic sometimes. There are definitely factors we simply cannot change. Age is a prime example. As we get older, well, our risk naturally increases. That's just biology.
Right.
And while you can't change your family history, having a close relative, maybe parents, siblings who has had a stroke, that does mean you carry a higher genetic predisposition. These are sort of the givens.
Right, you can't turn back the clock, like you said. And you certainly can't choose your relatives. Those elements are fixed points in our individual health narratives. But the core message, the really empowering message that resonates throughout the sources we've looked at today is this. While some risk factors are non-modifiable, the source says there are many other stroke risk factors that you can control, provided that you're aware of them. And it finishes with, knowledge is power.
That simple sentence, knowledge is power, it really encapsulates the entire premise of this deep dive, doesn't it? The sources make it abundantly clear that yes, acknowledging the fixed risks is necessary, but the real opportunity lies in focusing on the majority of factors that are within our influence and being aware of them. Well, that's the absolute prerequisite for taking any action at all.
Yeah, let's spend a moment just expanding on that idea of control, because the source really emphasizes that awareness isn't just academic knowledge. It's the necessary first step towards gaining control. If you're not aware that, say, uncontrolled high blood pressure is drastically increasing your risk, well, you have no reason to seek treatment for it, do you?
Precisely. Think of it like trying to navigate in the pitch dark versus navigating with a map and a flashlight. Awareness is the flashlight. It allows you to identify if a particular health issue or maybe a lifestyle habit is, as the source puts it, sabotaging your health and predisposing you to a higher risk of stroke.
Hey!
You simply can't fix a problem you don't even know you have.
And once that light is shown, once you have that knowledge, it directly translates into the power to act.
Right.
It empowers you to, quote, take steps to alleviate the effects of that risk. It shifts you from being sort of passive, potentially vulnerable, to becoming an active participant in your own health protection.
And that transition, that shift, is exactly what makes this topic so empowering, I think. We're not just here listing off risks like some kind of scary inventory. We're presenting actionable strategies, all derived from reputable health sources. This deep dive, it really aims to provide you with the specific information to understand what those risks are, and crucially, how to take those mitigating steps effectively.
Okay, so let's get concrete then. The Harvard Health source we're leaning on, it outlines 7 specific practical ways you can, and a quote, start reining in your risks today. These aren't just vague concepts. They are direct actions recommended by experts to significantly lower your stroke risk.
And the impact of focusing on these areas, it's cumulative, it's significant. Addressing these 7 points can, quite literally, fundamentally change your long-term risk profile. It protects your vascular health in really powerful ways. They represent, the major levers we actually have to pull in stroke prevention.
All right, let's kick things off. Top of the list and highlighted by the source as a huge factor, number 1, lower blood pressure.
Yeah, this one absolutely deserves to be number 1. The source doesn't mince words at all. It identifies high blood pressure as the single biggest contributor to the risk of stroke in both men and women. Its impact on the vascular system is just profound and widespread.
And the consequences of letting it go unchecked are pretty stark, aren't they? The source quantifies the danger quite clearly. If high blood pressure is not controlled, it can lead to doubling or even quadrupling your stroke risk.
Right.
That's just an astronomical increase.
It is.
It dramatically accelerates the wear and tear on your blood vessels, doesn't it? Makes them more prone to blockages or rupture, which are the underlying causes of most strokes.
Absolutely. And given that level of impact, it's really not surprising that the source concludes that monitoring and treating elevated blood pressure is probably the biggest difference people can make to their vascular health.
Mm.
So if you're looking for where to focus your energy, for the greatest return in terms of stroke prevention, this is very likely that area. Regular checks, understanding your numbers, working with your doctor, it's all foundational.
So what are the actual blood pressure numbers we should be aiming for, according to the source?
Well, the ideal goal that's often cited is less than 12/20/80.
Mm-hmm.
That represents optimal blood pressure. It minimizes the strain on the arteries over time.
Okay, ideal 12, 20, 80. But the source immediately adds a really important practical consideration here. It acknowledges the complexity of individual health.
Exactly. It explicitly states, and this is key, that there may be good reasons why you and your doctor will not want your readings to be this low.
Mm-hmm.
And this could be for, well, various reasons. Maybe you have other health conditions that make very low pressure risky, or certain medications you take might lower it too much, perhaps leading to dizziness or falls.
Yeah.
So for some individuals, the source says a less aggressive goal, such as no higher than 4/20/90, may be more appropriate.
Mm.
This is such a crucial point. While 12/80 might be ideal in a vacuum, your personal health situation dictates the right goal for you, and that absolutely requires medical guidance. It's not one size fits all.
That personalized goal is key then. So how do you actually achieve lower blood pressure? What are the specific recommendations in the source? This is where, the rubber meets the road for the listener.
Yeah, the source outlines several concrete strategies. Many of them overlap with general healthy living advice, but it provides specific targets. First off, reducing salt intake. This is just fundamental for blood pressure management.
Okay.
The target is quite low, no more than 1,500 milligrams a day, and the source helpfully translates that to about a half teaspoon.
Half a teaspoon. Wow.
Yeah. And that half teaspoon, remember, isn't just the salt you add at the table. It's the total salt from all sources. Processed foods, restaurant meals, even seemingly healthy packaged goods can be loaded with sodium. Reading labels becomes incredibly important here.
That really is a surprisingly small amount when you think about how much salt is hidden in everyday foods. Diet is obviously a major lever. The source also advises to avoid high cholesterol foods, giving common examples like burgers, cheese, and ice cream. Why is managing cholesterol linked so closely with blood pressure management here in the context of stroke risk?
That's a good question. While high cholesterol and high blood pressure are distinct issues, they often coexist. And they damage blood vessels through different but sort of complementary mechanisms. High blood pressure is like excessive pressure on the pipes, right? Causing strain and micro damage. High cholesterol contributes to plaque buildup inside those pipes, narrowing them and making blockages more likely. So both compromise the integrity and the function of the arteries supplying the brain. Addressing both diet quality and blood pressure numbers at the same time, well, it just offers compounded protection.
Makes sense. And the source provides a more comprehensive healthy eating pattern, too, beyond just limiting salt and cholesterol.
It does. It offers specific, actionable quantities, aiming for 4 to 5 cups of fruits and vegetables every day. That's a significant target for many people. But focusing on nutrient-dense, high-fiber produce is just so beneficial for overall vascular health and weight management, too.
4 to 5 cups.
Okay. It also suggests one serving of fish 2 to 3 times a week, likely emphasizing fatty fish rich in omega-3 fatty acids, which, are known to have cardiovascular benefit.
Right, like salmon or mackerel.
Exactly. And including several daily servings of whole grains and low-fat dairy sort of rounds out the pattern, promoting fiber intake, necessary nutrients, while keeping saturated fat low.
And exercise is listed here as well, though. As you said, we'll cover it more deeply later. But even just for blood pressure control, the source recommends get more exercise, at least 30 minutes of activity a day, and more, if possible.
Yeah, regular physical activity helps your heart become more efficient. It pumps blood with less effort, which naturally lowers blood pressure over time. It's a really powerful tool. Consistency is key, though.
And, as expected, I see quit smoking if you smoke is included here too.
Oh, absolutely. Smoking severely damages blood vessels directly. It makes blood pressure harder to control and just amplifies overall stroke risk across the board. Quitting is probably the single best thing a smoker can do for their vascular health period.
And finally, the source acknowledges that sometimes lifestyle changes aren't enough on their own. It says, if needed, take blood pressure medicines.
Yeah, and medications are a critical component of blood pressure management for many, many individuals. Lifestyle changes, they lay the essential groundwork, absolutely. But if blood pressure remains elevated despite those efforts, medication is a necessary and effective tool to reach your target goal and significantly reduce that stroke risk. The crucial phrase here is if needed, and the implicit understanding is that this is always done under the careful guidance of a healthcare professional. There are many classes of blood pressure meds, and a doctor can figure out the most appropriate one for your specific needs.
Right. Okay, moving on to the second powerful step from the source, lose weight.
Yeah, obesity and even just being overweight is directly linked to an increased risk of stroke. The source highlights this clearly. It states that obesity, as well as the complications linked to it, including high blood pressure and diabetes, raises your odds of having a stroke.
And this really points to the interconnectedness of these risk factors, doesn't it? Being overweight doesn't just independently increase risk. It often causes, or at least worsens, other major risk factors like high blood pressure and diabetes. It creates this kind of domino effect that significantly elevates stroke vulnerability.
Exactly right. Adipose tissue, body fat, particularly around the abdomen, is metabolically active. It contributes to inflammation, insulin resistance, increased strain on the cardiovascular system, all of which can lead to the conditions that predispose someone to stroke. So addressing weight can therefore have these positive ripple effects across multiple risk factors. It's not just about the weight itself.
And here's where the source offers a particularly encouraging insight, I thought. You don't necessarily have to achieve some dramatic, huge weight loss to start seeing benefits. It specifically notes that losing as little as 10 pounds can have a real impact on your stroke risk.
Now, that details is so important because, let's face it, significant weight loss can feel incredibly daunting. Knowing that even a modest, attainable goal like 10 pounds can genuinely move the needle on your risk profile, well, it provides a much more accessible starting point for many people. It really demonstrates that progress, not necessarily perfection, is the key.
The source does mention an ideal body mass index, BMI, is 25 or less. But again, it immediately follows with that crucial caveat that may not be realistic for you.
And that's so important. BMI is, well, it's a useful screening tool, but it really doesn't tell the whole story about an individual's health or their body composition. Focusing solely on hitting a specific BMI number can be discouraging or, frankly, inappropriate for some people. The emphasis should always be on sustainable, healthy habits and working towards a weight that is healthy for you. Which is why the source stresses the importance of working with your doctor to create a personal weight loss strategy. This isn't about jumping on the latest dieting fad. It's about finding a long-term approach that fits your life and your specific health needs.
Makes sense. When it comes to the how to achieve for weight loss, the source provides familiar tools, starting with calorie control.
Yes, the basic principle of weight loss is, consuming fewer calories than you expend. Energy in, energy out. The source gives a general range. Try to eat no more than 1,500 to 2,000 calories a day. But it's careful to note that this range depends on your activity level and your current BMI. So a larger, more active person will naturally need more calories than a smaller, less active person, even when trying to lose weight. It's about finding your appropriate calorie target, ideally with professional guidance, to create a sustainable deficit, not just slashing calories drastically.
And exercise is linked again, this time specifically for weight loss. The advice is to increase the amount of exercise you do with activities like walking, golfing, or playing tennis, and critically to do this by making activity part of every single day.
Yeah, physical activity burns calories, obviously, which is essential for weight loss. But just as important, regular activity builds muscle mass, which increases your resting metabolism, how many calories you burn just sitting around. It also helps regulate appetite and improve mood, making it easier to stick to that reduced calorie diet.
Interesting point about metabolism and mood.
And the suggestion to integrate it into daily life rather than just relying on scheduled workouts is really powerful. Taking the stairs, walking during lunch breaks, parking a bit further away, these small shifts add up significantly over time. It's about changing habits.
Which brings us nicely to point number 3, where exercise more actually stands on its own as a stroke prevention strategy.
Yes, and this is an important distinction the source makes. While exercise is absolutely vital for controlling blood pressure and losing weight, it also has independent effects that reduce stroke risk. So even if your weight and blood pressure are perfectly managed, regular exercise still provides additional protection. It strengthens your heart and blood vessels directly, improves circulation, and helps maintain the flexibility and health of your arteries. It's doing good things regardless.
So it's not just a tool for other health goals, it's a goal in and of itself for stroke prevention. What's the specific exercise recommendation here from the source?
The target is pretty clear. Exercise at a moderate intensity at least 5 days a week. That's a commitment, right? Most days of the week.
Yeah.
It highlights its importance.
Okay, moderate intensity. How does someone know if they're actually at moderate intensity? The source provides a handy practical test.
Yeah, give the talk test. Basically, when you're exercising at a moderate intensity, you should reach the level at which you're breathing hard, but you can still talk. You might not be able to sing comfortably, maybe, but you can hold a conversation using short sentences.
Okay.
If you can talk normally without feeling out of breath, it's probably light intensity. If you're gasping for air and can barely speak a word, that's vigorous intensity. Moderate is that sweet spot in the middle. A heart rate's up. You're working, but you're not completely wiped out.
Got it. The How to Achieve for exercise offers some practical, very approachable ideas for integrating this into your routine. It suggests simply taking a walk around your neighborhood every morning after breakfast.
Routine is just key to making exercise a habit, isn't it? Linking it to an existing daily activity like eating breakfast makes it much easier to remember and implement consistently. And making it social can really increase adherence and enjoyment. The source suggests start a fitness club with friends. Group exercise provides accountability and frankly makes the activity itself more pleasant for many people.
Good point. And also finding opportunities to move throughout the day, even outside dedicated exercise time. The source suggests simple things like take the stairs instead of an elevator when you can.
These small acts of incorporating movement, they really add up. They increase your total daily activity, which complements any structured exercise sessions and contributes to overall health and calorie expenditure. It's really about shifting your mindset towards being more active whenever the opportunity arises.
And recognizing that not everyone can dedicate, say, a solid block of 30 minutes, the source offers crucial flexibility. It says, if you don't have 30 consecutive minutes to exercise, break it up into 10 to 15-minute sessions a few times each day. That seems like a game changer for many busy people. You know, a brisk 15-minute walk during lunch break and maybe another in the evening could fulfill the recommendation. It removes that all-or-nothing barrier.
Exactly. The total accumulated time throughout the day matters. Getting 30 minutes in, say 3 10-minute blocks or 2 15-minute blocks, provides very similar cardiovascular benefits over the course of the day as one continuous 30-minute session. It makes the goal much more achievable for diverse schedules and lifestyles.
Point number 4 deals with something many people grapple with. If you drink, do it in moderation.
Right. The relationship between alcohol and stroke risk is, well, it's a bit nuanced, and the source addresses this directly. It states that drinking a little alcohol, such as an average of 1 per day, is okay. Moderate consumption doesn't appear to significantly increase risk according to the sources reviewed here. And, some studies even suggest potential benefits for cardiovascular health at very low levels.
And but there's a very clear point where the risk changes dramatically.
Yes, this is where the warning comes in loud and clear. The source is explicit. Once you start drinking more than 2 drinks per day, your risk goes up very sharply. Notice the wording.
Yeah.
Very sharply. This isn't some gentle incline. It's a significant acceleration of risk when consumption exceeds that 2 drinks a day mark.
Why is that?
Well, heavy drinking can increase blood pressure, it can contribute to heart rhythm problems like AFib, which we'll discuss shortly, and it can directly damage the heart muscle itself, all of which seriously increase stroke vulnerability.
So the goal is pretty simple and protective. Don't drink alcohol or do it in moderation.
And moderation is precisely defined in the source, which is helpful to avoid confusion. It means have no more than 1 glass of alcohol a day. That daily limit is key. It's not about averaging it out over the week where you might think, oh, I'll have 7 drinks on Saturday. No, it's a daily maximum of 1.
Right, that's an important clarification. The source includes an interesting little detail here regarding red wine, too.
It does. It notes that some studies suggest red wine might help prevent heart disease and stroke, presenting it as a potential first choice if you choose to drink that single daily glass. This is likely due to antioxidants like resveratrol found in red wine. But the source correctly attributes this to some studies, indicating, it's not a definitive, universally accepted conclusion. And it's certainly not a recommendation to start drinking red wine for health benefits if you don't already drink.
Good point. And to truly stick to that 1 drink a day rule, Understanding portion sizes is absolutely essential, isn't it? The source provides standard definitions to prevent us from accidentally and underestimating how much we're consuming.
Oh, this is crucial because drinkware sizes vary so much these days. A standard-sized drink, as defined in the source, is very specific. A 5-ounce glass of wine, 12-ounce beer, or 1.5-ounce glass of hard liquor.
Okay, 5-ounce wine, 12-ounce beer, 1.5-ounce spirits.
Exactly. Think about a typical restaurant wine pour. It's often 6 or even 8 ounces. That means a single glass out might actually count as 1.5 or even close to 2 standard drinks. So paying close attention to these standard sizes is vital if you choose to drink and want to stay within those moderation guidelines for stroke prevention.
All right, let's move to point number 5, which addresses a specific medical condition. Treat atrial fibrillation, or AFib.
Yes, AFib is a significant and independent risk factor for stroke. The source defines it concisely as a form of irregular heartbeat. Normally, your heart beats in a regular coordinated rhythm, but with AFib, the upper chambers, the atria, they sort of quiver chaotically instead of beating effectively to pump blood.
And this irregular, ineffective beating leads directly to the mechanism that causes stroke in AFib patients, right?
Precisely. The source explains this mechanism very clearly. AFib causes clots to form in the heart. Those clots can then travel to the brain, producing a stroke. Because the atria aren't contracting properly, blood can pool there, and stagnant blood is much more likely to clot. These clots can then break off, travel through the bloodstream up to the brain, and block a vital artery, resulting in what's called an embolic stroke.
And the risk associated with AFib is quite high, isn't it? Not a minor factor.
No, it's substantial. The source really emphasizes this, stating that AFib carries almost a 5-fold risk of stroke and should be taken seriously.
5-fold?
Wow. Yeah. That means someone with uncontrolled AFib is roughly 5 times more likely to have a stroke than someone of a similar age without the condition. This dramatically elevates its importance as a stroke risk factor. You can see why it gets its own point on the list.
Given that high risk, the goal here is straightforward and pretty urgent. If you have atrial fibrillation, get it treated.
Absolutely. This is not a condition to leave unmanaged. It requires medical diagnosis and proper intervention. The source suggests being aware of potential symptoms, things like heart palpitations or shortness of breath, and advises seeing a doctor for an exam if you experience them. But it's also important to know that AFib can sometimes be asymptomatic, meaning no symptoms at all, which is another reason why regular medical checkups are so important, especially as we age.
Right. And how is AFib typically treated in the context of stroke prevention, according to the source? What's the main approach?
The primary focus for stroke prevention in AFib is preventing those clots from forming in the first place. So the source states that treatment may need to take an anticoagulant drug, blood thinner. It specifically mentions such as one of the direct-acting anticoagulant drugs, often called DOACs, as a common class used today. These medications reduce the blood's ability to clot, thereby significantly lowering the risk of those heart-formed clots traveling up to the brain.
Okay, blood thinners.
But the source appropriately stresses, your doctors can guide you through this treatment. Anticoagulant therapy requires careful management. It's a balance between reducing the risk of clotting versus increasing the risk of bleeding, so it needs professional oversight.
Makes sense. Point number 6 is treat diabetes. Like obesity and high blood pressure, this seems deeply interconnected with vascular health.
It absolutely is. Diabetes, particularly if it's poorly controlled, is incredibly damaging to blood vessels throughout the entire body, including, critically, those supplying the brain. The source explains the core mechanism. Having high blood sugar damages blood vessels over time, making clots more likely to form inside them.
How does high sugar damage vessels exactly?
Well, high glucose levels circulating in the bloodstream directly injure the delicate endothelial cells that line the blood vessels. Think of it as a constant low-level injury. This chronic damage leads to hardening and narrowing of the arteries, that's atherosclerosis, and it creates a surface inside the vessel that's more prone to clot formation. Over time, these damaged, narrowed vessels become much more vulnerable to blockages.
Okay, so that cumulative damage is what significantly raises the stroke risk in people with diabetes. The goal, therefore, is paramount. Keep your blood sugar under control.
That's the bottom line.
What does under control entail in practical terms, based on the source? How do you do that?
It really involves consistent, diligent management. It starts with monitoring your blood sugar as directed by your doctor. For some, this might mean daily finger prick checks. For others, maybe using continuous glucose monitors, depending on the type and severity of their diabetes. Understanding your numbers is always the first step to managing them.
Right, you need the data.
Exactly. And then using the familiar tools we've already discussed for other risk factors, it's an integrated approach. The source points to using diet, exercise, and medicines to keep your blood sugar within the recommended range. So a healthy eating pattern, very similar to what's recommended for blood pressure and weight, is crucial for regulating blood sugar.
Mm-hmm.
Regular exercise improves insulin sensitivity, which helps your body use glucose more effectively. And for many people with diabetes, medication, whether that's oral agents or insulin, is necessary to maintain target blood sugar levels and prevent that long-term vascular damage. It's really the combination of these strategies, always guided by a doctor, that provides the best protection against stroke and other complications of diabetes.
Okay. Our final point on the prevention list, number 7, is quit smoking. The source frames this as one of the most impactful changes you can possibly make.
Yes, absolutely. The source explicitly places smoking cessation right up there, along with a healthy diet and regular exercise, as one of the most powerful lifestyle changes that will help you reduce your stroke risk significantly. Its negative impact on vascular health is just immediate and severe. There's no ambiguity about it.
And the source provides clear mechanisms for how smoking increases risk. It accelerates clot formation in a couple of different ways.
It does. It describes two key processes. First, smoking actually thickens your blood, makes it more viscous, more prone to clumping together and forming dangerous clots.
Thicker blood.
Second, it increases the amount of plaque buildup in the arteries. The thousands of chemicals in cigarette smoke directly damage the artery walls. They promote the deposition of cholesterol and other substances, which narrows the vessels and makes them more rigid, less flexible. So you've got thicker blood trying to flow through increasingly narrowed, damaged vessels. It's really a recipe for blockage and stroke.
Yeah, that's a dangerous combination. So the goal is straightforward, even if the execution can be really challenging for people. Quit smoking.
This is perhaps one of the most difficult lifestyle changes for many people to make. But the benefits for stroke risk and, frankly, for overall health are enormous, and they begin almost immediately after quitting. The source acknowledges the difficulty and suggests practical steps. The first is simple. Ask your doctor for advice on the most appropriate way for you to quit. Your doctor can assess your individual situation, your level of addiction, and recommend strategies tailored to you.
And there are numerous aids available now to help people succeed.
There really are. The source mentions using quit smoking aids, such as nicotine pills or patches, counseling, or medicine. Nicotine replacement therapies, NRTs, can help manage withdrawal symptoms. Counseling provides crucial behavioral support and coping strategies. And certain prescription medications can reduce cravings and withdrawal effects. Often, a combination of these approaches is the most effective strategy.
And importantly, the source includes a really crucial message of persistence and self-compassion, which I think is vital.
Oh, absolutely. This is so important for anyone attempting to quit anything addictive, really. The source says, don't give up. Simple, but powerful. Most smokers need several tries to quit. It encourages you to see each attempt as bringing you one step closer to successfully beating the habit.
That reframing is helpful.
It really is. Relapses are common in the quitting process. They're almost part of it. But they don't erase the progress made. Each attempt is a learning opportunity. And perseverance, learning from what didn't work last time, is absolutely key to long-term success. Focusing on progress, not setbacks, is the mindset needed.
So those 7 points, managing blood pressure, losing weight, exercising regularly, moderating alcohol, treating AFib if you have it, treating diabetes, and quitting smoking, they provide a really powerful, actionable roadmap for significantly reducing your stroke risk, all based on the detailed information from trusted sources like Harvard Health.
Absolutely. Focusing on these controllable factors, it really puts the power back into your hands when it comes to your long-term health destiny. They represent the most significant modifiable levers that the source material identifies. Acting on them makes a difference.
Now, shifting gears just slightly, but staying with this theme of empowerment through knowledge, the sources also underscore something absolutely critical for everyone to know, regardless of their personal risk profile: recognizing the warning signs of a stroke when it happens.
Yes, this knowledge is just paramount. Because even with the very best preventative efforts, strokes can still, unfortunately, occur. And when they do, acting quickly is the single most important factor in minimizing brain damage and improving the chances of a good recovery. The source makes a very pointed observation about why people sometimes delay seeking help. It says, too many people ignore the signs of stroke because they question whether their symptoms are real.
Right. They hesitate.
They might feel silly calling 911 or think, oh, it's probably just temporary, or I'll just wait and see if it goes away.
And that hesitation, that moment of questioning, can unfortunately cost precious, irreplaceable brain function. We often hear the phrase time is brain in the context of stroke, don't we?
We do, and it's absolutely true.
The source delivers a strong, urgent call to action based on this reality. Don't wait if you have any unusual symptoms. Listen to your body and trust your instincts. If something is off, get professional help right away. Don't second guess it.
Exactly. Emergency treatments for stroke, like clot-busting medications, thrombolytics, or procedures like mechanical clot removal, they are highly time-sensitive. They are most effective, dramatically so, when administered within just a few hours of the first symptom onset. Recognizing the signs quickly and getting to a hospital that's equipped to handle strokes can literally be the difference between a full recovery, significant long-term disability, or even worse. Every minute counts.
Okay, so what are the specific warning signs that the source tells us to watch for? These are the indicators that should trigger an immediate call for emergency medical help 911 or your local equivalent.
The source lists several key signs that represent sudden neurological changes. These include weakness on one side of the body. This might be a sudden drooping of an arm you can't lift, or a leg giving way. Along with that, often, numbness of the face. This is often noticed as one side of the face drooping when the person tries to smile. It looks asymmetrical.
Okay, weakness on one side, face numbness or drooping. What else?
Another critical sign is an unusual and severe headache. Now, lots of people get headaches, but a stroke-related headache is often described differently, like the worst headache of your life. And crucially, it comes on very suddenly, sometimes accompanied by other neurological symptoms like dizziness or vision changes.
Sudden severe headache. Got it.
Other signs include vision loss. This can be sudden blurry vision, double vision, or even complete loss of sight in one or both eyes. Also, numbness and tingling, which might feel like pins and needles, or complete loss of sensation, usually again on one side of the body.
And finally,
And an unsteady walk. A person might suddenly lose coordination, feel intensely dizzy or vertiginous, or have trouble walking in a straight line when they were fine moments before.
so these are the key sudden symptoms. The facial drooping, the arm weakness, speech difficulty, which often comes with the weakness numbness, the sudden severe headache, the vision problems, the numbness tingling, the unsteadiness. These are often highlighted by public health campaigns like the FAST acronym, FACE, arms, speech, time to help people remember them easily. While the source lists the signs individually, the underlying message is identical. Recognize these sudden changes and act immediately. Call for help.
Yes, and it's crucial to remember that key word. Suddenly, these symptoms appear abruptly. A gradual onset of similar symptoms is less likely to be an acute stroke, although it still warrants medical attention, of course. But that suddenness is a real hallmark of stroke warning signs. Don't ignore sudden changes.
Right. So, pulling together everything we've discussed in this deep dive, what's the overarching message, the key takeaway we want the listener to walk away with from this exploration of the source material on stroke prevention and recognition?
I think the most powerful takeaway is one of agency. It's about control. While certain risk factors like your age and your family history are, well, they're fixed, they're beyond our control. The sources we've reviewed make it incredibly clear that we have significant power and maybe even responsibility regarding the majority of factors that influence our stroke risk. Knowledge of these factors, understanding them, and then taking consistent action on them can dramatically alter your personal risk profile for the better.
It really is empowering to know that managing aspects like blood pressure, your weight, your diet, getting regular exercise, moderating alcohol consumption, and properly addressing conditions like AFib and diabetes, these aren't just vague healthy habits. They are specific, evidence-based strategies identified by leading health organizations like Harvard Health and the American Heart Association as direct ways to reduce your risk of a potentially devastating event like a stroke.
Exactly. And equally important, maybe just as important, is the knowledge of those warning signs. Empowering yourself with that knowledge, knowing what to look for, and committing to act immediately if you or someone around you exhibits them. That's a critical layer of protection. It provides the best possible chance of a positive outcome should a stroke occur, despite your best preventative efforts. Prevention is key, but preparedness is also vital.
This deep dive really reinforces that being well-informed about both prevention and recognition isn't just beneficial, it's truly a fundamental part of safeguarding your long-term health and your independence.
Absolutely. Taking control of these modifiable risks and being prepared to recognize the signs promptly, it's perhaps one of the most important investments you can make in your future health and well-being.
Well, this has been an incredibly important deep dive, packed with actionable knowledge. Thank you so much for sharing your expertise and helping us unpack these vital sources today.
It's been my pleasure. It's information that genuinely have the power to change lives, so it's always worth discussing.
And thank you, our listener, for joining us on the deep dive. We've explored those 7 key areas where you can take concrete action to reduce your stroke risk, and we've covered the critical warning signs you need to recognize immediately. So, considering how interconnected all these factors are and the vital importance of timely action, here's something to think about. What's the single smallest change you could realistically commit to making today, based on what we've discussed? And perhaps just as important, who in your life could benefit most from you sharing this vital information with them?